Hi, I'm Michelle and welcome to Pelvic Exercises. Well, today we're looking at the 4 best positions to do your Kegel exercises during pregnancy. Now, I'm going to show you some positions upright and I'm also going to show you positions lying down for when your pregnancy progresses. So let's get started straight away. Great position to do your Kegels is sitting. So you can do this during the early stages of the pregnancy as your baby's lighter weight. It's easier to do your Kegels in upright positions so that you're actually then lifting bub, so lifting the muscles inside, your pelvic floor muscles inside against gravity. So we're going to be lifting up and in. So what you do is rather than sitting back and slumping against the back of the chair, you lean forward and you keep the inward curve in the back. So you don't want to be slumping and using the back of the chair. Nice tall posture. And then you're lifting and squeezing in and around your 3 pelvic openings, so the back passage, the vagina and the urethra, the urine tube, lifting up inside, lifting up and squeezing inside, and then lowering down slowly and resting. So sitting down is a great position if you're waiting for an appointment, sitting on the train, sitting on the bus, might be a great time to do some of your Kegels. That's the first good position to start with. Now the other position that's upright in the first, say months 1 to 5, really good positions to use, is standing. So just simple exercises standing up, again, making sure that your posture's lifted, your chest is nice and tall, shoulders are back and down, and again, that you've got the inward curve in your lower back. So you can do your Kegels both in sitting and standing for those first 4 to 5 months. Now, as your baby grows and gets heavier, that's when you might need to change your position. So you might find that you need to lie down to get more activation through your pelvic floor muscles. If you can continue to do your Kegels upright in that time, that's great, but otherwise, let's move on to some of those positions lying down. So the first position on the mat, on the ground, is on all fours. So if you can come down when you're a bit larger, baby's growing, gives you plenty of space, and also too now you're not lifting your pelvic floor muscles against gravity, so this makes the exercises easier. So you've got knees underneath hips, hands roughly underneath shoulders, and then you've got your inward curve in your back as always, and doing your exercises in that position. Now, if your wrists are sore with your pregnancy, if you've got carpal tunnel syndrome, you might find that coming down onto your forearms like that is more comfortable, and that's fine to do your exercises in as well. And then you might find that anti-gravity position really helps you do your Kegels more effectively. Now, finally, in the later stages of pregnancy, you possibly need to lie down to feel your Kegels. So lying down on your side. Obviously, you can't lie on your back to do your Kegel exercises from 16 weeks onwards because that decreases the blood supply through to your heart and through to your baby. So we don't want to do any exercises lying down on our backs from 16 weeks. But lying down on your side is great. So coming down sideways, and you might need to even use a pillow underneath bub, so to support bub that way, or you might also find that a pillow between your knees makes this comfortable too, and keeping your head down so that your neck's relaxed. So in this position, you could also then do your Kegels. You can obviously do these lying in bed when you first wake up and during the course of the day if you get the chance to have a rest. So you can see we've gone through quite a number of positions there that you can actually practice. So early stages of pregnancy, you're trying to do your Kegels in upright positions, standing and sitting, and then try to continue some upright exercises during the course of the day if you can in the later stages of your pregnancy. But if you're unable to, you can come down and do them on hands and knees, hands and forearms, or lying down. Well, I hope that's helped you with your Kegels. If you'd like some more exercises during pregnancy and general physiotherapy exercises, just subscribe down below. I look forward to exercising with you again soon. Bye for now.